The COVID pandemic has been really hard on workers at rural hospitals around the country.
According to CNN, in 2020, 19 rural hospitals closed. The Cecil G. Sheps Center for Health Services Research says that's the biggest loss since they started keeping records in 2005.
Tonight, we'll look at how hospitals serve people in southern Illinois, starting in Illinois' least populated county.
News 3's Danny Valle visited Hardin County General Hospital to see how workers there are handling resources post-pandemic.
COVID-19 nearly crippled the hospital's finances. When the pandemic hit, it lost a lot of patients who were afraid of going out and contracting the virus. On life support, the hospital got much needed help from the American Rescue Plan, and that helped them gain much needed equipment, some of it state-of-the-art. But the question now, and the concern is, what happens when federal funds stop flowing in?
Had it not been for the mines, it's really doubtful that there would have been a hospital.
In 1958, the tiny town of Rosiclare, the former fluorspar mining capital of the world, welcomed Hardin County General Hospital. Not much has changed outside, except for the hard-to-miss coal furnace that's no longer in use.
We're unique. I get told that all the time.
Since 1981, Roby Williams has served as the hospital's CEO. He hears the word unique often, but also how, as in how is this hospital still around when 82 other rural hospitals like it have closed since 2015, according to the American Hospitals Association.
To those of us that have worked here in the hospital and lived in this area, it's critically important for us to see this hospital survive, and we're going to go to the wall to make sure that it does.
Hardin County General is a critical access hospital. They receive reimbursement for each Medicare patient, but when COVID hit, patients stopped coming over fears of getting the virus. But then came the American Rescue Plan.
Had it not been for those grant funds, I'm not sure, just from a cash perspective, that we could have survived.
Those funds helped 8 other critical access hospitals in southern Illinois, 3 in western Kentucky, and 1 in southeast Missouri. The money allowed Hardin County General to purchase a CT scanner and other state-of-the-art equipment that Williams deems necessary, but not as much as the staff who stayed behind in the midst of a pandemic.
If there hadn't been opportunities for them to go somewhere else to work, there certainly has and is now. And for them to stick with us, I mean, I just feel like that's a testament to them.
It's one of the reasons that Williams is against consolidating with a bigger hospital. He wants to keep local control and not risk becoming a hospital of the past.
We're to the place now where I think it's not crying wolf. We're talking about a situation that's real and could jeopardize the existence of a lot of the small rural hospitals. I mean, we got an immobile population here, as much as anywhere in the state of Illinois.
But it gets harder to budget each year. And Williams hopes there can be a bigger focus on keeping hospitals running if COVID funds dry up.
Rural hospitals have to exist. I mean, you can't close them all. To be able to have that, I think there's going to have to be some consideration on some of the reimbursement.
Until then, they keep hanging on, providing care until they can't.
We've never been quick to give up. Our first priority is to take care of patients. And we do it whether we're paid or not. There's no service that we deny because of somebody's inability to pay.
Hardin County's ambulance service dissolved in March, so the hospital bought its own ambulance and began services on April 1st. That will run for the next year, according to Williams. After that, they'll decide if they'll keep the service, and Williams says they'll try and make it work because it's a critical service. In the studio, Danny Valle, News 3.